Assessing the neurologic and musculoskeletal system. Initial steps. Identify the patient. Confirming the patient's identity ensures the procedure is performed on the correct person and builds trust. Explain the purpose of the procedure and answer any questions. Explaining the assessment helps the patient feel informed and comfortable. Perform hand hygiene. Washing hands prevents the spread of germs and ensures safety for both the patient and the examiner. Help the patient undress if needed and provide a patient gown. Assisting the patient ensures ease in preparing for the exam while maintaining their dignity. Begin with a survey of the patient's overall hygiene and physical appearance. Observing the patient's appearance provides useful clues about their overall health. Assessing the neurovascular system. Assess the patient's mental status. Evaluate orientation to person, place, and time. Evaluate level of consciousness. Assess memory, immediate and past recall. Assess abstract reasoning with a proverb. Test the ability to understand and follow commands. Test cranial nerve functions. Assess the sense of smelling using familiar scents. It evaluates the function of cranial nerve 1. Test shoulder shrug and cheek resistance. Checks muscle strength controlled by cranial nerve 11. Assess neck movements. It identifies pain or limitations in neck mobility. Ask the patient to identify familiar objects by touch. It tests sensory nerve function and tactile recognition. Trace a number on the patient's palm with eyes closed. It evaluates sensory, perception, and cortical functioning. Assess deep tendon reflexes. Test wrist reflex. It indicates proper nerve and muscle function in the arm. Test antecubital reflex. Checks for normal nerve responses in the upper limb. Test triceps reflex. Assesses motor neuron function in the upper arm. Test patellar reflex. The knee jerk reflex provides information on lumbar nerve function. Test Achilles reflex. It evaluates nerve and muscle function in the lower leg. Stroke the sole of the foot to test the plantar reflex. It helps assess neurological function, including the Babinski response. Test foot dorsiflexion and plantar flexion against resistance. It measures strength and mobility of the lower legs and feet. Assist the patient to a standing position and observe their gait. Walking provides insight into balance, coordination, and muscle strength. Perform the Rumberg test. Observing swaying with eyes closed assesses balance and coordination. Assessing the musculoskeletal system. Ask the patient to extend arms forward and turn palms up and down quickly. It evaluates coordination and smooth movement of the upper limbs. Ask the patient to flex arms and resist opposing force. It checks upper arm strength and nerve function. Inspect and palpate hands, fingers, wrists, and elbows. It identifies any joint abnormalities, swelling, or tenderness. Ask the patient to squeeze your fingers. It assesses grip strength as an indicator of hand and forearm function. Perform the straight leg test. It helps detect irritation of the lower back or sciatic nerve. Assess hip abduction and adduction. It evaluates the range of motion and strength in the hips. Test thigh resistance in various directions. It checks the strength and control of thigh and hip muscles. After procedure, assist the patient to a comfortable position. It ensures that patient feels settled and comfortable after the assessment. Perform hand hygiene. Prevents the spread of germs and maintains hygiene standards. Document the findings of the assessment to provide a clear record of results for continuity of care.